Here we are.
Hello, Los Angeles.
Here we are, just another day at the office.
Just another day. What is going on here?
Another ideal face and body day.
That's right. So we've got something very special planned for you guys today. We got Ashley in position.
Ready for action.
And we are going to be doing a couple procedures today on her to keep this beauty beautiful.
I'm so excited.
Yep. So we are going, hey, can you grab that paper?
Yeah.
So we are going to be doing a couple things a little bit later, but we're going to be Botoxing or disporting her face. Hello, Jennifer.
Hi, Jennifer.
And so we're going to be putting some toxin in these muscles, which is the glabella, in the frontalis muscles here for the lines across the forehead, and around here there's this sphincter, and we're going to be doing it right here for the crow's feet. So that will be coming up a little bit later, but first we wanted to touch upon a couple things. Didn't you say something about, oh, that was in a bowl. Well, we were talking, we should scoot the,
oh yeah.
Hold on, one second. We're gonna just scoot this stuff, hopefully it won't fall. But since we have,
Can you see?
can you see it?
Yep.
There we go.
You need some Botox now? Yep, me too.
Yep. We all need Botox.
Yeah, you can call our office. Should we put our number up there?
Yeah, so she will, no one's at the office right now, but we are also going to be, should we put the YovinoMD stuff?
Yeah.
Okay, so for those of you that don't know, we have our own skincare line. It's called YovinoMD Skin, and it is a medical grade skincare line, and what that means is that the amount of goodness in the products, the amount of active ingredients is higher than anything that you can buy at any store. And we have a full line that includes cleansers, toners, all retinols for around your eyes, for around your face, for your neck, for your chest. Did I say acne stuff? We've got stuff for acne if you have any teenage sons or you're breaking out yourself.
Yeah. Maskne? Is that what we called it? Maskne?
No, maskne is when, for COVID, a lot of people are complaining that they're getting a bunch of breakouts in the area of the mask. And so we call it maskne. So we have some good products there for you to help with that. Yeah, acne. It is acne, but because the mask is causing the acne, we call it maskne. And we have everything here. So we have stuff for bruising, this erase paste, anti-acne pads, we have an anti-acne serum, and just a bunch of goodness. So go to YovinoMDskincare.com to learn all about it. Yep, my 15-year-old just turned 16, and he is a pain in the butt. But he does use my products, and I put especially the retinol on his face as well. So we are going to be doing two things today. The first thing that we're going to be doing is, and Ashley is pinning the stuff, is we're going to be doing a little bit of toxin on her face. So we'll get ready for that. Hold on. Okay. And she's in the bikini because she...
Just because it's what I hang out in.
This is how she comes to work.
Yeah.
We're like,
Yeah.
But so if you have, I see someone needs skincare for acne, please go visit our website, YovinoMDskincare.com. That's pinned at the bottom. But Ashley has stretch marks, and she has stretch marks right on her breasts, right here, and she wants those treated. So we will be doing a resurfacing procedure on her today as well, after we do the toxin. So we are going to be using Dysport today. A lot, which I find very unusual, is that a lot of my first time patients are like, Dysport? I've never even heard of that. So what I say is, like, there's two main companies for neurotoxins in the United States, and it's Botox and Dysport. And it's kind of like, if you talk about supermarkets, like a Ralph's and a Pavilions, they both do the same thing, and they both have pretty much the same ingredients, and they both have the same effect. So they're just two different competing companies. Dysport is owned by Galderma. They have all Restylane brand fillers and Sculptra, and Botox is by Allergan, and they have all the Juvederm products. So we are going to be doing some toxin on her. So for the 11s, we're going to be treating these 3 muscles here, the procerus in the center and the 2 corrugators on the side. And then these are the 2 frontalis muscles, the blue ones. And those are for these pesky horizontal lines on the forehead. And then around the eye is a sphincter. So we're going to be treating around the eye here for the crow's feet and a little bit in the upper portion here to help elevate her eyebrows slightly. So for people that have heavy eyelids, it's just a little trick of the trade. So we will be putting a little bit of toxin here for that. What does that say?
Okay, so let's see. Who would like to transition to aesthetic nursing badly? It's a pretty great field.
Oh, you're a Hank and Henry. Oh, we love
Any best way to go about it?
We love Henry, and we love when he's Hank. So we already pre-drew that up, and it's right here. We use very, very tiny needles, which is only a 32 gauge, really, really small. You can't even see it if I'm all the way back here. But even here, they're really, really tiny and small. And you know what? I realized I didn't get any alcohol wipes, so I will be back in 1 second. Give me 1 second. So why don't you talk, Ashley?
So I'll talk about how I like my Botox, because it's kind of different for everyone. And today I am getting Dysport. The last time I got any toxin with Dr. Sarah was in the beginning of February. And so mine lasts a pretty long time. My preference for the toxin that I have in my face is 0 movement. I don't like any movement. So I actually hold on to my toxins for a pretty good amount of time. You can see I don't have a ton of movement, but I don't like any movement. So anytime, there's that, that's when I say, hey, Dr. Sarah. So the last time I think we did Dysport too.
I think it works a little better.
I kind of prefer it. Yeah.
But do you want to show them your movement?
Yeah, I did. So
in the background.
Yeah, so I mean it's there.
And then what about your frown?
So
I was done a little longer. Like, look, you can't even see the lines on my forehead. And then when I like scrunch, you don't see them here, and then here I can't really make bitch look. So
right, that's good. So it's just to everyone's preference how they prefer to have their toxins, and that's what's great about Dr. Sarah is it's really like whatever it is that you want.
So we're gonna get a little bit closer so you guys can see exactly what I'm doing.
Hi, Jessica.
Hold on, I think I did the wrong one.
Hi, Dale.
Hi, Dale. We hope you're doing well. Dale is my husband's father, and we wish him well. He's in Tampa. I just gotta turn that so it doesn't. You just gotta turn it a little bit more, and you can hold it.
Yeah.
Okay, and what did we do with the gauze? Okay.
So, this is not my first rodeo when it comes to this. I've been getting toxins for a while, but it does make a huge difference on who you go with. That's why I love when Dr. Sarah does my toxins.
So the first thing we're going to do is we're going to clean her face with alcohol. You can see right there all her makeup. We want to take all of that off, just because you don't want makeup introduced deeper into the skin. So you can see it's like nice and clean here, so she doesn't have a ton on. And then we're going to do the forehead as well. Just kind of clean that up. Yeah, you don't have a lot of makeup on.
Because I use YovinoMD skincare.
Okay, so we are going to be cleaning that skin here.
For your patients, how often do you like them, or what do you see as far as their timeline for getting more toxins?
Really, everyone's different. It all depends on when they're moving again. And some people really want a frozen look. So the minute you start noticing any kind of movement in the face, then you may want to come and just get retreated. But it's not necessary. But it's typically every 3 to 4 months.
Mm-hmm. Mine lasts pretty good. I mean, we did mine in February. When was the last time?
Yep.
So, hey everyone, if you're just now joining us, we are here. Dr. Sarah Yovino is going to be doing some Dysport on me.
Mm-hmm. So do you want to, okay, so I'm just going to hold it over here. So
I can come in a little bit closer.
Yeah, do you want to hold it, or do you think you're going to
I feel like my arm might be, I'm for sure going to close my eyes.
Oh, okay, forget
Okay.
it. Okay, so I'm going to be coming over here. I'm going to feel her ridge. Do you want a little elevation of the side of your eyebrow?
I love that.
Okay, so I'm going to just feel right here where her ridge is. I'm going to be going in very lightly, barely going in, and doing a little pinch. So
it does not hurt at all.
So you will bleed a little bit if you've had a lot of alcohol in the you had a lot of alcohol in the last 24 to 48 hours. Or you've been chomping on aspirin or Motrin, okay? So
I haven't been doing that.
Yeah. When was the last time you made somebody to drink?
Monday.
Okay.
Just a little glass of rosé.
So if she bruises, it's all
It's
her
my
fault.
It's my fault. I'm a bruiser anyway.
Okay, so I'm going to be coming over here. Just a little tiny pinch. Just a little tiny pinch. And then I'm going to feel where I'm at. Okay, yep. Little tiny pinch. And a little tiny pinch. Oop, drippy drip. Okay, well, we're right there. So that's it, except for this one. What happened?
I felt like the screen went dark. Hi, everyone.
Okay, so what I want, and I know you want to hold.
Yeah.
Just hold it.
Okay.
See if you can. It's better.
I know, we're funny, Dale. So just getting my Dysport with Dr. Sarah if you're just now watching.
Okay. I just want to.
Just wave at everyone.
Okay, so we are going to be right here. I already alcoholed her. Well, actually, I'll do this eye. Okay, can you see?
Yep.
Okay, you can close if you want. Okay, so we're going to go right up in here to get a little bit of elevation. We're going to go right here, 2, 3, 4. Just like that.
And if you guys have questions, be sure to ask.
Okay, then we're going to go right in the center.
Hi, Jasmine.
And we're going right here.
Hi, Deb.
We're going to go right here.
The master.
Right here. I don't know if you guys can see, but, and then whoops, sorry, did I just get that in your eye? I'm just gonna try to go a little bit lighter. Okay, so we're gonna do one more here, pointing upward. And then one more right here. Okay.
Hi, Dale. Dale says hi.
Hi. Hello.
Doesn't this lip color look great on Dr. Sarah today? Huda Beauty.
Yeah. Okay, so then lift up your eyebrows. And so can you guys see these lines that are across here? Can you see them?
They're there.
And so you can see those two muscles that go up like this. This is the frontalis muscles. We want to block those out so her forehead will be nice and smooth. Yeah, you are a bruiser. Okay, lift your eyes up. Yeah, so I really want to go right here. So here's one. We're just going to lay down teeny tiny bits. I like to sometimes shake. It's a little bit more comfortable for the patients. Just a little bit of shake, a little bit of wiggle. Oh, sorry. I'm in an awkward position. You never want to say whoops when you're doing something. When you're sticking a needle in somebody's face. Okay, but then we're going to go right here. And then
Thank you.
We're going to go right here.
You know, needles don't really bother me. I've been doing this for a minute now, but Dr. Sarah's technique is so comfortable. I don't have any numbing, anything like that. So for me, her gentle technique is what allows me to probably do this with no numbing. I don't think I've ever gotten numbing for Botox.
No, most people don't. But we do sometimes we'll give a little bit of not alcohol, but a little bit of ice to vasoconstrict. And that helps decrease the incidence of bruising. So we're all done there. So we did 3 big muscle groups. So when people get Botox, they ask like, hold on, get this over there. They want to know exactly where in the face people get Botox. So there's multiple different areas. So we just did the procerus here and the glabella and the corrugators. This area is what's called the glabella. Mm-hmm. Some people don't like the little, can you scrunch your up nose? So this is the bunny line. So some people want those areas treated. So we just put a little bit of toxin in the muscle there as well. The 2 big frontalis muscles that are like right here that help elevate and they cause those horizontal lines across the forehead, that we also treated. There's a sphincter around the eye. So most commonly for the crow's feet, it's done here at the sides. But if you want to get a little bit of elevation, in the side of the eyebrow, so like a little bit of a cat eye look, mm-hmm. then you can block part of the muscle up in here. Sometimes if people are very, very crepey underneath the eyes, I'll put a little teeny drop of toxin in there as well. Some people want their lip to have a little bit more show, and that's called a lip flip. So we will put a little bit of toxin here for a lip flip. Some people grind their teeth at night. It's called bruxism. It can be very uncomfortable. So we will put toxin in both the masseter muscles as well. And some people get dimpling of the chin and they don't like that. And so we will sometimes put some toxin here. Can you show your, push out your lower lip? Like that. Okay, do you see the dimpling that is occurring here? So some people don't like that, and over time, the older you get, sometimes that dimpling remains. And so we'll put some toxin in here to soften this muscle as well. You can relax. And then as you get older, you get these platysmal bands that run like this. These are the platysmal bands, and these can also get toxin put in these to soften these, and that's called a Nefertiti lift.
Oh.
So that's all kind of the most common areas. I injected a little bit for you, those of you that saw the live the other day with Henry and myself when I was doing his nose. I put a little bit of toxin at the base of his nose as well to help prevent the downturning of the nose when he smiles. So that's kind of it really for all the different areas on the face that somebody would get Botox or Dysport. Other people would elect to get it in the palms of their hands for sweatiness, which is called hyperhidrosis, or in their armpits for hyperhidrosis as well. And we've also had somebody who got it in their full scalp for that as well. What does that say?
You will see my forehead lines tomorrow.
Yes, we will.
Yay!
We can't wait, Jose.
We're so excited.
And so we just did that on Ashley. So that kind of concludes. If anybody has any questions about the toxins, we are here to answer them, but those are the most common areas where people will get them. And then sometimes if people have like one muscle that's like in a state of spasm like this, then I'll put some toxin in the muscle to relax that as well. I had it right here in like the base of my neck. It was like hurting so bad. And so then my husband injected me with a little bit of toxin there.
He said, I'm ready to start getting older gracefully. We agree. Listen, father time is undefeated. It's all about doing it gracefully.
I'm going down kicking and screaming. I don't know about you guys gracefully. What are you talking about? Hell no. I'm going down to fight.
Yes.
Yeah, no. I'm fighting all along the way. So do you want to show them this area here?
So I have some stretch marks on my breasts, and they're not super bad, but enough where if I can do something about it, then I should. So I'm about to get real up close and personal with you guys. You can see I'm all oiled up. It's
not oil.
Yeah.
It's numbing cream.
It's numbing cream. So it is numb here, and you can kind of see some of the stretch marks. And we're going to be doing the Venus Viva, and I'll let Dr. Sarah tell you about the Venus Viva.
So Venus Viva is nanofractional radiofrequency. It will create micro channels from the tip. Actually, I don't even have the tip on. What am I doing? Here's the tip back here. So it's not pins. It's not the same as microneedling. What this is going to do is this is going to create a heated channel. So the radio frequency will go down into the skin and almost create like a wedge in the skin. And what happens is it goes beyond the collagen layer, and it's going to kick the collagen layer up to produce new collagen and to tighten the skin. So it is very, very good at resurfacing. If you have any irregularities to the skin, if you have stretch marks, it's going to tighten them. If you've got an ugly scar, it will flatten it. If you've got some discoloration, it's going to help with that. And it's going to help tighten up your pores as well. I have stretch marks too, but they aren't bad. But like you said, we'll do something about it. Yeah, we can do something about it. And so here's the tip I'm going to show you guys really closely. So it's not pins. They call them pins, but they're actually just little metal attachments here. And then on the back side is where the radio frequency current goes through to the tip of these pins, and it will create a heated channel within multiple heated channels. So everywhere you see there's a contact, it's going to create a tiny, tiny, tiny hole. So each of these pins has, I think it's like 4 contacts each. For each of these little bars, there's 4 contacts. So that's 4 times 5, there's 20 groups, and each group has 4. So you got 80 little holes it's gonna create from this one tip.
Is this good for pores on the face too?
Yes.
I'm gonna be asking your guys' questions, so keep them coming.
I'm gonna show you like my skin. So I did this twice in the last like 2 months with COVID, and you can kind of see that my pores are nice and small.
Dr. Sarah has amazing skin, so yes, it is great for that. And can you do the procedure on your face for skin tightening, Dr. Sarah?
Yes, and that's exactly what I did.
Yeah.
I did it on my full face, and then I started doing it on my neck, because my neck needs a little, like, see that? Like, it needs help. So let me put this on repeat mode so we can get started here. But yeah, it will kind of shrink wrap your whole face because it creates all these channels, and then it kicks in the collagen, and it's a great collagen stimulator. Anybody over, really, it depends. Like if you have acne and acne scars, then you can start at an earlier age. But typically for rejuvenation or resurfacing, it's somebody who's a little bit older who can start to see textural abnormalities of their face. So like unevenness, roughness. If you look in the mirror and you feel like you look a little coarse, then you're gonna wanna do something like this as well. And Ashley's never had this done.
This will be my first time.
We have very, very good numbing cream on her. That is like a 23% tetracaine and a 7% lidocaine, right? Hold on, let me just make sure.
It's over on the table.
Where? Oh.
So if you're just joining us, we started with some neurotoxins on my face. Dr. Sarah kind of froze this area here. And now we're going into a radio frequency treatment called Venus Viva.
And it is radio frequency skin resurfacing. For those of you that know laser, it's kind of similar to laser, except it's safer on all skin types. And Ashley, being of Italian descent, would be considered a Fitzpatrick 4. And so you got to be careful with lasers with anybody over a Fitzpatrick 3. And so she would be anyone Hispanic, anybody of Persian descent, anybody of Italian descent or Greek. You'd at least be placed in a Fitzpatrick 4 category, regardless of if you're tan or just happen not to be tan at the time. It's the amount of melanin that you actually have in your skin. Somebody's coming in. Who is that?
Dun, dun, dun.
Oh, it's Dr. Justin! Yay! Welcome! Dr. Justin had 2 surgeries today.
Yep.
Super busy guy. Anyway,
What's going on around here?
come over, we're doing some Viva.
What's going on?
You want to show them your fancy car over there in your hand? Okay, so we're doing a 23% lidocaine and 7% tetracaine in a really good base that's going to absorb deeply in her, so she's very numb. Do you feel like you're numb if you touch it? What
Yeah.
method?
Yeah.
So we're gonna go ahead and take that off. So do you want to put it? You want to put it back in here? Or you think you can hold it? Is it uncomfortable?
No, it's not bad.
Okay.
I think it might be better.
So show them your area. Okay. So we're gonna kind of take off one at a time.
Getting real up close and personal with you guys.
Oh, I need a garbage. Okay. So I don't know if you can kind of see her stretch marks a little bit. She is very tan right now. So I'm just gonna get some of this off. Okay. And I'm gonna alcohol it.
The girls are numb. Yes. That's what we want.
Okay, just so I can see where I'm gonna be working. What happened to my little pencil? Down here, it fell on the ground.
Hi, Joe.
Shoot the porno over here.
Yeah.
Don't be inappropriate, Dr. Justin. You can only come if you're gonna behave. God. Okay, so I'm just gonna mark here where her stretch marks are in the area that I'm gonna be working in. Let me just. You want me to go closer, or is that good?
Oh, that's okay.
Okay. So we're just going to be, so you can see right in here, but you can see the stretch mark come like this. There's one here, there's one here. I don't think we need to go this high. What do you think?
No, I don't think we need to go that high.
Okay, so I'm going to say that your last one is like there. What do you think?
Yeah.
Okay. So we're going to get started. I'm going to put it on ready mode.
Joe Melons. Yep.
Okay, so we're going to come across here. We're going to first start, hold on, I'm all tangled up.
So this is my first time having a Venus Viva treatment. I'm super excited.
We're going to start here. So it's
Not bad.
quick and easy, and you can see here there's not that much redness here.
Not bad.
We are doing a light procedure on her. So what does it feel like?
It just feels like a little shock. Yep.
Like I'm electrocuting you.
Yeah. It's really not painful.
Okay, do you guys? You'll start to see.
Ooh, I just saw a little bit of smoke.
So Ash is getting all ready for this weekend.
Yep.
We do have an intense recovery cream, so you can see a little bit of smoke arising from her breast.
So how this all came about was because I noticed these stretch marks.
Well, you're a little bit out of the.
Oh, sorry.
Wait, can you show this part? Yeah.
I noticed I was getting stretch marks on my breasts, and I asked Dr. Sarah, I said, does our Tech Neck cream help with that? Because I apply it to my neck and décolleté every night. So I was thinking, since there's retinol and stuff on it, it might help. And what she said, yes, you can do that, but the Venus Viva is definitely going to be better. So here we are.
And we're just kind of going in a little stepwise progression.
I'm very comfortable.
Okay.
No pain.
And I'm going to stop for a second and show you. Can you show kind of, can you guys see here's the area that was treated before. And you can start to see a little bit of redness coming out on my first pass. And here's the second one. You can kind of see a little bit there as well. And then this was the third one that I was starting over. And you can kind of see a little white line. That's her stretch mark right there. It's a little bit more prominent.
You want me to keep it? Just let me know where you want.
Yeah, can you see what you're showing?
Yeah.
So we're just making our way over step by step. And I don't know if you can, once there is a little bit of swelling that will occur. And then after the procedure, what she should expect is that she's going to feel like she's sunburnt in this area. So you can kind of see.
You can kind of see, yeah.
Can you kind of see like the little bumps that are forming? I don't know if you guys can make that out. So those are the little channels that have formed. And that will be
resurface.
Let me just move over there.
And we have our intensive recovery cream that I will be using after this is done. Can you ice the area afterwards? The patient's asking.
You shouldn't.
You should not ice the area afterwards. And Dr. Justin just made a comment that this machine is great and it can be used all over the body. What are some other areas that you've used it on, Dr. Sarah?
The face, the abdomen, to resurface the entire abdomen.
Wow.
Of course, the face, the neck, the décolleté. The face, the neck, this is the décolleté, like right here. Stretch marks from a C-section or an abdominoplasty. We've done it on that. On the butt, for stretch marks on the sides of the butt when people grow too fast. I need mine done there. I've got a little few.
The arms, Dr. Justin just said the arms.
Oh yeah, the arms too. You really, anywhere you have skin, you can use it.
A lot of our patients who get surgery will, depending on what they're having, will get this done at the time of their surgery because they're already kind of
Drugged up.
Yeah, they're already feeling good. Wow, this numbing cream is so great. Would that help with my acne scars is a question.
Yes, absolutely.
Yes. How will it help? What will it do?
It does the same thing. It resurfaces. It will cause a remodeling of the skin by creating these little channels, and then the skin just bounces back. So do you see it kind of went over the whole thing? It's this little red patch. They said they're supposed to do like 2 to 3 passes for stretch marks. So maybe I'll just go over your stretch mark itself.
Okay.
Is it hurting you?
No. I'm chilling. Okay, so someone just joined. Hi, Sydney. So welcome to our Instagram Live every Wednesday at 5. Right now we are doing a treatment called Venus Viva. Dr. Sarah is administering the treatment.
Hi.
And this is radio frequency. You want to explain it?
It is radio frequency, and it's kind of like a laser, but it's radio frequency instead. And just like a laser resurfaces the skin by creating these like little tiny micro, Dr. Justin saying it's nanofractional radio frequency, but just like a laser would create a heated channel, this does the same thing, and then it will smooth out the skin, similar to say microneedling, except this is heat and it's no needle going in. So it's doing the same thing, but it's like a heated channel instead, and it creates better tightening than microneedling would. So we're already done with one side. I'm gonna move back over to do the other side now.
It is pain-free. As someone who's getting it right now, it's pain-free. No issues with the pain.
But you had that numbing cream on.
I had numbing cream, yeah.
This is all numbing cream that I'm taking off right here.
Very strong numbing cream. It's great.
Yeah,
So you can see the difference. Oh, I watched you do Hank and Henry's Botox. Awesome.
Okay, awesome.
She just
Yeah.
did mine.
Yay.
The Botox queen.
We love Hank and Henry. We love all of our patients, actually.
So, your mom's on.
Hi, Mom. See you in 2 weeks.
So, should I show them the difference?
Sure. Let me just kind of mark this one out.
Okay.
I feel like you have more on this side. Do you feel that?
Yes.
I can kind of feel this one a little more. Like when I was cleaning it, I can feel the skin's like thinner here. Let me just make sure I don't feel any stretch marks. Yeah, no, that one's fine. Okay.
Should I show them the difference?
Yeah.
Okay. So you can kind of see the difference.
This is treated and this is untreated. So this is what our skin started out with. And then this is one treatment. And you can kind of see right here how it's a little bit swollen and puffy. And what happens is this is like a sunburn today. And then tomorrow she'll be less red, especially using our intensive recovery cream that we have. And on day 3, all these little tiny dots, there's micro dots in here, they will start to brown and it will feel a little bit like sandpaper. And slowly that will come off. It's not gonna peel off like a skin peel would, but it will slowly come off like as if you got tan. And that's it. It's 5 days of pretty much, if you consider it downtime, it's about 5 days worth of downtime. Very well tolerated.
I want to lighten my, do you lighten stretch marks? Someone's asking.
Lighten, we do have creams that are lightening creams that go up to 10% hydroquinone. that you can get in the office. We also have, depends on the scar. If the scar has a lot of redness in it, we have lasers that could also treat the scar as well. So we have multiple different modalities in the office to treat a hyperpigmented scar. So it really depends on what the scar looks like.
I love that I can see like some smoke coming off.
Ashley barbecue.
Yeah. So it's very tolerable. If anyone's watching, wondering if it's painful or anything like that, I do have on a topical numbing cream. So I'm pretty comfortable here. I'm just on their living room couch, hanging out.
And the only reason that we're here is because the Wi-Fi in the office, it wasn't good to
yeah.
do these lives.
Not good.
AT&T, I don't know what's going on.
Yeah.
So we're just kind of moving on up. And this typically, because it is a non-ablative treatment, typically you get your best results with a series of 3. So we have packages at the office for people that want to do a full series. You get it discounted, or you could elect to do 1 and see how your results are and then continue with the process. But typically you see the best results after the second treatment, and then, go from there. Each one incrementally does that much more from the first procedure. How are you doing with the pain?
Great. Completely fine.
So I did this on my face. Dr. Justin did it on me during our quarantine. And then I did it, like how many weeks ago? Like 2 weeks ago or something?
What are the most popular areas that you treat patients with?
The face and neck. Face, neck, and décolleté are probably the most common treatments. The good thing about radio frequency is that it can be used on all skin types versus laser that you can't, you have to be very careful, when you get, the darker you become, or the darker the patient, the more you have to be careful of permanent scarring, either hyperpigmentation or hypopigmentation. You just have to be very, very careful with that.
So a patient just asked, what is the treatment for? So we are treating my stretch marks with Venus Viva, which is radio frequency. So if you have stretch marks, I know we already kind of went over this, but for the people who are just joining, what is the Venus Viva great for?
It is really good to resurface and to tighten and to smooth out the skin, to tighten the skin, to tighten pores if you're going to do it on the face, to even out the tone, and there's so much.
I know, that's what's great about it.
It'll even out the tone, it will tighten, it will decrease the depth of any kind of wrinkle. It can be paired with platelet-rich plasma on there to give an even better result. Or we do have a recovery cream that is great as well. We do it to make the pores on the face smaller, to tighten the face, to tighten the neck, to help with crepiness, to help with irregularity, irregular scarring, fine lines and wrinkles. It's a collagen builder. It will build collagen, and it will also help increase your blood flow to that area, because it produces your body will kick in and then produce new blood vessels to treat the area.
So I will then protect the treatment.
So this is what it looks like. I'll show you what it looks like. You can't really see anything there, but this is what it looks like. So these little pins send a radio current through them, and what it does is it creates a heated channel. Someone's asking, did you get my comment, Sydney?
Let's see. I think we did. Yes, purple stretch marks
on your legs.
And I think Dr. Justin answered. The purple may be better treated with a laser.
Okay. So, discoloration and dyschromia in the skin, if you've got stretch marks or they're, on your legs, that could be spider veins as well. So I would have to really see what it looks like to make that decision on how best to treat it. But we have, like the Rolls Royce of lasers at the office that can really treat almost any skin condition out there, from melasma and rosacea to spider veins to resurfacing to acne. tattoo removal. What else? Hair removal. Although we don't do the hair removal that much, but it does do that as well. But so this is radio frequency. It's great because it's perfect for all skin types. Even a Fitzpatrick 6, which is very dark skin, and it will help resurface. It's safe for all skin types. It's great. And coupled with really good quality medical grade skincare, your results will be exponentially better. Someone asked about spider veins.
Yes.
Do you inject spider veins? We do that at the office. We also have a laser that can treat spider veins as well. I think there was another question.
Dr. Sarah does my tattoo removal.
Yeah. So we are working on Jasmine's tattoo removal. Maybe we'll have her on the next live.
Yeah.
And we'll do tattoo removal of her foot if she's willing to be on. And that would be a good one. We could do her tattoo removal next time. Mm-hmm. But that would have to be done at the office, really.
Right.
And then the Wi-Fi kind of sucks there. But maybe if only one of us is on, it won't be so bad.
Right.
So we'll consider that.
We'll figure it out.
So let me just kind of go hit these one more time. I'm almost done here.
Hit him with your best shot. So yeah, I had these stretch marks, and I asked Dr. Sarah, you know, what would be great for it, and she said the Venus Viva. So here we are. I'm excited to treat the progress that we will be making with our intensive recovery cream and our sports defense sunblock to protect all of the work that Dr. Sarah is doing. What is the cost for the spider veins? So
The best is to call the office.
yeah, if you want to call the office, which I'll put in the number quickly. Let's see.
What else do I want to do? I have to record this down with the treatment.
So I just put the number for our office for the spider vein. So go ahead and you can give us a call tomorrow. We open at 8:30.
And so now this is what Ashley looks like after. The white lines here was just my drawing to just see where I want to go. Make sure that I kind of cover the whole area. I can go over here. Yeah, I think she's good right there. We are going to be putting a intensive recovery cream on her right now for post-treatment. Let me just cover this up with the new tip. Okay.
Oh yes, we do lots of procedures for double chins. So we have Precision Sculpt and Kybella. So where is that question? Love in my life. I hope that answered your question. We absolutely treat double chins in our office. Could I send you a picture of the stretch marks on our legs? So I sent to Sydney, who asked about the stretch marks. I put our telephone number. The best thing would be to send it over email, and you can call the office tomorrow to get our email, and we can take care of that for you. So a recap of the treatments that we did today. We did Dysport all over, and then we did...
Do you want to just rub that in? Yeah. That is the intensive recovery cream. You know, here, intensive recovery cream.
And what will this do for this procedure?
That will speed up her recovery. It's going to decrease her redness. It has a lot of anti-inflammatory molecules and components within it, and it will help take down her redness. By tomorrow, she's really not going to be that red. If she didn't use it, she's going to be very red today, and it's going to kind of be a little uncomfortable. Tomorrow she would be less red, and then by day 3 she's going to start to brown. So this intensive recovery cream will speed up that healing significantly. So tonight she's going to be like, oh, I'm not even that red, and then tomorrow it's going to pretty much be gone, and then she will recover much quicker. We had to get her all prepared for this boating that she has on Sunday. So when someone's I'm like, you did what? So hopefully this will all be healed by then. That's what we're praying for.
Me too. And isn't this procedure then, since someone, you could really go to work the next day if someone gets it on their face, correct?
Yes.
Okay.
I did.
Yeah.
It all depends on what your work is and how much you really care what you look like. You can do it the next day. You will be a little red, but you can wear makeup and cover it up as well, which is what I did. And most people won't even notice that you even had anything done. You'd be like, look, I got this procedure done on my face. Mama Garbar joined. So how you doing? And we have Sydney, and we have got Dr. Justin on here as well, making his comments. And so we did a combination procedures on Ashley. We did Dysport on her face, and then we did Venus Viva right here on her chest for her stretch marks. And this is going to help tighten the area as well. So she's going to be very happy when this all heals, and she should really, for the best overall result, is to do this 2 more times in that area as well.
Super excited. Yes, we are located in Beverly Hills. I saw that question.
Hi, Mama
up there.
Garbar. How you doing? I hope you're doing well. And what else did we want to let people know? So
YovinoMD skincare in the
so-
house.
some of you guys, we do have with Hank and Henry, we do have a giveaway that will be picked tomorrow at noon. So please pay attention. We'll go live for that. Do lip laser removal. Lip laser. What do you mean lip laser removal? Like you mean lip tinting? This was pain-free because we have a very good numbing cream, so she didn't feel any
Pain-free,
of that.
no pain.
She didn't feel any of that. But I'm not sure what you mean by lip laser removal. We do fat
filler.
transfer to the lips, and we do lip filler, and I do lip flips with Botox, and upper lip hair removal. Oh, yeah, we do have hair removal at the office. And let's see what else. Check out our line at YovinoMD Skincare. We have something for everybody. And so Lauren, we hope you win the giveaway.
Woo-hoo!
We are going to be picking at noon tomorrow. So there should be 2 winners, and then 2 people that they tag also will win. And what you're going to win is you're going to win our our acne defense regimen. And I don't have all the products out here right now. I have some of them because I think I took some in my bathroom and I'm using it. But within that, we have a retinol. We have a retinol, which you're going to be putting at night that increases your cell turnover and allows penetration of the products. We have a product that is a serum that will increase your collagen and elastin by almost 200%. We have what's called filler in a bottle. It's hyaluronic acid. Any filler that you get in your face is made of pure hyaluronic acid, and that's what keeps you hydrated. So you'll be using that instead of another moisturizer because that will moisturize your face better than anything else. And then, what are the other things in it? The fill in bottle. It's our ideal cleanser. It's really a nice big size cleanser. I keep this in my bathroom shower, and I only wash my face with that. I love it, love it, love it. And the last thing you get is a sunscreen. I think it's our Sports Defense sunscreen. So it's a great starter pack for anybody that really wants to see changes within their skin.
Yeah, the medical grade skincare is the way to go if you're looking to invest in your skincare and really get the most out of it. I entered as well. Wow, so many people entered. That's so awesome. We can't wait.
Yeah, it's going to be great.
Yeah,
Super
fill in a
excited.
bottle for sure.
So please follow us tomorrow. See us tomorrow at... and then one of our patients, he's commenting right now. He has used, Jose, he's used our products already. Actually, he won one of our giveaways during COVID. We had a giveaway during COVID, and he won that giveaway. Yep. And has been using it. And, you're really going to see results with our products. Being medical grade, everything is kept at a much higher concentration than anything that you can get from the store. And it's clinically proven to give you results, so you are going to love it. And Cindy's asking again.
The lip removal.
Pain-free. There is a little bit of discomfort on that as well, but it's very quick. I mean, you're like zip, zap, zap, and done. So it's nothing to worry about, Sydney. And that is kind of it. So we will be wrapping it up. Any last minute comments?
Last many comments, questions?
Yeah, because Instagram will kick us off at the hour mark.
Yeah.
And so we only have 11 minutes left if anybody has any other questions. But we have offered a full service of anything that you could want for your rejuvenation, skincare, your body reshaping, or plastic surgery needs. Please check out our parent website, which is idealfaceandbody.com. That is idealfaceandbody.com. You'll see it right here. We're located in Beverly Hills.
Do you have anything for acne scars?
As far as our skincare for acne scars or for treatment, we have treatments for acne scars definitely at the office. We have multiple different modalities. I'd have to see what your acne scars look like, whether they're ice pick scars or they're rolling scars or they're these like box scars. It depends on what it is, and we choose the treatment. Some people, their acne scars are really, they have cords that are tethering them down, and you may need subcision, which is just like cutting it at its base and allowing it to come back. We do that as well. What are you doing right now? I just joined. So we already finished. Welcome, Brianna. Brianna, we did some Dysport on Ashley, which is like Botox. It's just another brand across her forehead, here for her 11s, and right here in her crow's feet. And then we just did a resurfacing procedure for the stretch marks on her breasts, which is called Venus Viva. So we just finished that. So we are at our tail end and wrapping it up and answering last minute questions for anybody. If you guys also follow Hank and Henry Beauty, he is doing a giveaway with us. It is only on his site, but then you have to come back to our site and do a bunch of stuff that he wants you to do to be entered properly. And we will be picking our winner tomorrow at noon. And you can win a whole line of our YovinoMD skincare with the age defense regimen. So it is great. You guys will love it.
Visit YovinoMDskincare.com.
Okay, and we do have some specials just in general for that. I think our sunblock is on special. Mm-hmm. We've got two great ones, one that's tinted and one that is more like absorbs in and then protects you if you're being physically active outside. And then, hi Gina, love, how you doing? And what else? What's our special on? Oh, we're trying to get rid of Skin Medica.
Yeah.
Forget about the special on the idealfaceandbody.com. But so we are super excited. Thank you guys for joining.
Thank you for watching.
And for those of you that just joined and missed it, we go live every single Wednesday at 5 p.m. So 5 p.m. every Wednesday on my Instagram, we go live for 1 hour and we go over something that you want to know behind the beauty. And we talk about all things within the industry, coming from Hank and Henry. Well, welcome, Gina Love. Thank you for joining us. We love Henry, and he has been our patient for a very long time. And we are glad that he's, also vocal about it. And if you visit my Instagram, you'll see that, there are some other influencers on there as well. We love all of our patients.
Yep, we really do. Next week, we have a guest joining us. Her name is Siggy Bennett. She is a makeup artist, has a skincare guru, everything you could want to know, makeup, skincare. She's awesome. She's also quite the chef. So we're going to have a lot to talk about.
And she lives here in Los Angeles. Mm-hmm. And she is an influencer in our area and really around the world, right?
Yeah.
What kind of food does she cook?
Oh, man. Food that after you eat, you're probably going to need some precision sculpt. Her most recent, she has a show called Signature Dish. And her most recent one was a buttermilk fried chicken recipe. So
I was thinking about doing some sort of like that, but then I'm like, my butt probably can't handle it. But I love fried chicken.
Yeah.
Love it.
She does too.
But does she do a fried, you could do the same thing and bake it, right?
Right, yeah.
Probably not the same though.
Or an air fryer, which I want so bad.
Oh yeah, so then okay, you've been talking about that.
I know. All right, well, we will be signing off. Any final comments, Dr. Sarah?
No, thank you guys all for watching, and we can't wait to draw for for the winner tomorrow at noon. So please pay attention and come to our Instagram live tomorrow at noon from the office.
Tomorrow at noon, next Wednesday at 5.
Okay.
Bye.
Bye.